Hey, this is Robin from the Back Pain Secret Podcast, and today I want to talk about why you need to stop doing stuff that isn't working for you in your life. This aspect goes on all areas in your life, but specifically back pain, because this show is about back pain, okay?
So, here's the important question. How can back pain sufferers like us, who don't want to use prescription drugs or go through surgery, heal our back pain? How do we live our daily lives in a way that allows us to go to work, take care of our families, enjoy life, and still manage our back pain? That is the question, and this podcast will give you the answer. My name is Robin Wakeham, and welcome to Back Pain Secrets.
So, to give you a bit of a background, I've been a physiotherapist for 20 years now. 25 years back, I injured my back playing ice hockey. For 3 years, I was struggling daily with pain. But big back pain in my back, radiating down my leg. I was depressed. I was on painkillers. At one point, it got so bad, I didn't really want to live, It's horrible. I couldn't hang out with my friends. I couldn't do activities. I was just home watching TV. Very, very awful period in my life, okay? So I know if you're struggling right now with your back pain, I know what you're going through, buddy, okay? Definitely. So, true story. About 6 months back, I had this little sweet old lady, we can call her Greta. Greta was a librarian. She'd been working as a librarian for almost 30 years, okay? She was about 60 years old. So she comes into my office, and I asked her, hey, what's up, where's your pain? And she said, in my lower back, okay? And she said, well, I've been struggling with back pain for almost 20 years now. Okay, and I asked her, what are you doing about it, Who are you seeing? What exercise are you doing? What medications are you taking? And she told me, well, I've really just seen 2 people. And I've been seeing the same 2 people for 20 years. And I said, what are you talking about, Greta? For 20 years, the same 2 people, and you're not feeling better? And she said, no, not really. Well, I said, if you're not getting better, Greta, first off, who are you visiting? Well, she had this physiotherapist, and she'd been visiting him for almost 20 years now, like regularly, once a week or every second week. And then she had her doctor that she visited like once a month, okay? The same people for 20 years. Isn't that nuts? And I said, well, are you getting better? He said, no, not really. Well, I said, why are you keep on going then? He said, well, I don't really want to let them down, right? If I'm feeling bad, They try their best. But I said, well, yes, Greta, but they are there for you. You shouldn't be there for them. You're paying them good money to go there, okay? It's not enough, Greta, to go there and have a nice chat if they're not delivering. They've had their time. 20 years, Greta. For Christ's sakes, woman, okay? We had a bit of a laugh about it, but she saw the irony in it, And I told her, you've been in pain for 20 years, so don't expect any miracles, okay? Don't expect that I'm going to be able to heal all your back pain. The only thing I can really give you, my friend, is I'm going to make sure that you get the examinations and we go through the different steps you need to go through so we can take a decision if you should even continue to go to a physiotherapist or any other therapist. Maybe you have a terminal condition, Greta, that's not going to be helped with therapy. You're just going to need to learn to live with the pain, okay? As horrible as that sounds, at least you know why you are in pain. Do you know why you are in pain right now, Greta? He said, no, I don't have a clue. So, okay, first off, I examined the back. I sent her for an MRI scan. We got her on some lighter exercises. I got her in the pool, like water aerobics for elderly people. She enjoyed that. So the MRI scan came back a few weeks back or a month or something like that. And it was very clear. She has a diagnosis called spinal stenosis, okay? Spinal stenosis is a diagnosis in your back where basically your nerves get pressed, okay? And so you have pain and you have problem walking longer distances, and you have a tendency, you want to bend over to open up the space so the nerves can breathe again, basically. Very easy summation of spinal stenosis. So I said, Greta, this is the reason why you are in pain, my friend, and you've been in back pain for almost 20 years now. So it doesn't really matter if you come here, okay? I'm not going to be able to help you or reduce your pain. What we need to do, or you need to do, you need to keep doing the water aerobics, okay? and you need to check your ergonomics around your desk or your job, okay? And you might need to get some other things to do at work. You can't be doing like a lot of lifting of the books all the time, okay? We need to switch that around, and you should buy a TENS machine, okay? TENS machine looks like this, basically. Put that on your back for 20 to 25 minutes a night, okay? And you might visit me or someone else like every 6 months to get an update, okay? You don't need to visit the physiotherapist every week. You don't need to visit the doctor for your back pain every month, okay? They're not going to be able to help you. You don't need to visit me, okay? So she looked kind of shocked, at me. She said, well, it makes sense, okay? And I said, well, Greta, just imagine it, okay, that all the time that you spent on this, okay, that you could have been spending on something else, done something else, okay? And I see a lot of patients that are doing this, they're just doing the same stuff from habit, day in, day out. It's not working for them. They don't really want to do it, but they're doing it because they don't have the courage or the knowledge or just the get-go to change, okay? If you are in back pain and you've been visiting the same people for 6 to 10 to 12 months, it's not working, change, okay? If you are in a relationship that's not working and you're trying to go to like therapy and you've been doing it for years, and you're just miserable and nothing is working, okay? You might want to change it up, okay? If you're in a job that's horrible, okay? A job that's not working out for you, you feel stressed, you're not appreciated, change, okay? Life is too short, guys, okay? And all this stress when you're not doing the stuff you want to do, that's also something that creates a lot of stress in your life, and it goes to your back, okay? Sorry for the rant, guys, but this shit just gets me going, okay? I see so many people, I've been struggling with this myself, okay? So I understand where you're coming from, but you need to make a switch, okay? In your life, okay? Okay, guys, take care. I love you. I'll talk to you tomorrow. And guys, remember, you're just one step away from healing your back pain. Bye-bye.
Want more back pain secrets? Then go ahead and get your free copy of my best-selling book, Back Pain Secrets, at backpainsecrets.com. Inside this book, you will find my top secrets to healing your back pain without prescription drugs or surgery that have helped thousands of other people just like you.